Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 082. A 23-year-old man complains of severe pain in his left knee joint. Objectively, the left knee joint is enlarged, with hyperemic skin, painful on palpation. Complete blood count, erythrocytes 3.8, 10 to the power of 12, L, HB 122 grams, L, leukocytes 7.4 times 10 to the 9, L, platelets 183 10 to the power of 9, L, erythrocyte. Sedimentation rate 10 mm per hour. Bleeding time, Duke method, 4 minutes. Lee-White coagulation time, 24 minutes. Partial thromboplastin time, activated, 89 seconds. Rheumatoid factor, negative. What is the most likely diagnosis? A. Hemorrhagic vasculitis, Henoch-Schonlein purpura, articular form. B. Thrombocytopathy. C. Hemophilia, hemarthrosis. D. Werlhof disease, immune thrombocytopenia. E. Rheumatoid arthritis. Hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. The patients have low levels of either factor V or factor X. Common symptoms of hemophilia: hemarthrosis, bleeding into the joints, causing swelling and pain, or tightness in the joints of the knees, elbows, or ankles. Bruising, bleeding into the skin. Hematoma, bleeding into the soft tissue, muscles, tendons, ligaments, or fascia, causing a buildup of blood in the area. Bleeding of the mouth and gums. Frequent and hard to stop nosebleeds. Bleeding is hard to stop after start bleeding. Blood in the urine or stool. Bleeding time is a medical test to assess the platelets' function. It makes a patient bleed and measures the time how long it takes to stop bleeding. Duke's method. 1. The patient is pricked with a special needle or lancet, preferably on the earlobe or fingertip, after having been swabbed with alcohol. The prick is about 3 to 4 mm deep. 2. The patient then wipes the blood every 30 seconds with a filter paper. 3. The test ceases when bleeding ceases. The usual time is about 2 to 5 minutes. Lee-White coagulation time. 1. 1 milliliter of venous blood is collected with a plastic unlubricated syringe and placed into a glass tube without any anticoagulants or coating at room temperature, 25 degrees C. 2. The timing started as soon as the blood is drawn into the tube. The tube is left undisturbed for 5 minutes and then checked for clots every following minute by gently tilting the tube. 3. It is considered normal when sample clotted in up to 9 minutes. Later than that, it may be considered coagulopathy. Activated partial thromboplastin time is one of several blood coagulation tests that measures how long it takes the blood to form a clot. It is used to look at how well the clotting factors are working. It measures the overall speed at which blood clots form by means of the intrinsic pathway and common pathway of coagulation. The typical reference range is 30 to 50 seconds depending on laboratory. A positive rheumatoid factor test result indicates that a high level of rheumatoid factor protein produced by the immune system is detected in the blood, which is closely associated with autoimmune disease, e.g. rheumatoid arthritis, Sjogren's syndrome. The answer is C. Hemophilia, hemarthrosis.